Welcome to another episode from the Veterinary Medicine Digest. The intricate world of veterinary critical care often presents us with laboratory results that spark more questions than answers, and perhaps no single finding is more ambiguous or common in the emergency setting than hyperlipasemia, or significantly increased lipase activity in the blood. For decades, elevated serum pancreatic enzyme activities, specifically hyperlipasemia, have been central to diagnosing acute pancreatitis in both human and veterinary medicine, yet our understanding has evolved considerably, forcing us to rethink what a high lipase value truly signifies. Today, we delve into a comprehensive review of recent research focusing on hyperlipasemia in dogs, revealing that this common finding is frequently associated with a variety of non-pancreatic conditions, and may serve more as a marker of severe systemic illness rather than a straightforward diagnosis of acute pancreatitis. To begin to understand this complex picture, we must first recognize the tools used to measure this enzyme. Lipase is a member of the lipase superfamily, secreted primarily by the exocrine pancreas, responsible for breaking down dietary triglycerides in the intestinal lumen. The concentration of canine pancreatic-specific lipase, known as pancreatic lipase immunoreactivity, is currently considered the most accurate blood test for acute pancreatitis in dogs, though its sensitivity and specificity vary depending on the concentration cutoff used and the severity of the disease. Alternatively, the DGGR lipase assay, named for its substrate, 1,2-O-delauryl RAC glycero 3-glutaric acid 6-O-methyl-resorphin ester, is a more recently validated test that has shown high agreement with the pancreatic lipase immunoreactivity test. Given the reliance on these tests, distinguishing true acute pancreatitis from clinically irrelevant elevation of pancreatic enzymes, often referred to as hyperinsulinemia, is extremely challenging, especially in critically ill dogs dealing with multiple concurrent diseases. In critically ill human patients admitted to intensive care units, high serum pancreatic enzyme activity is reported in anywhere from 14% to 80% of cases without prior pancreatic disease, suggesting that non-pancreatic factors are frequently at play. In dogs, a retrospective study examined the prevalence of hyperlipasemia in a large cohort of critically ill dogs admitted to the intensive care unit. This study found that a significant increase in DGGR lipase activity, defined as greater than 3 times the upper reference limit, occurred in 16% of the 1,360 dogs assessed upon admission. Strikingly, of these dogs presenting with significant DGGR hyperlipasemia, 68% were not ultimately diagnosed with acute pancreatitis based on clinical and ultrasonographic findings. This suggests that DGGR hyperlipasemia is a frequent finding in critically ill dogs at admission, even in the absence of overt clinical acute pancreatitis. This phenomenon mirrors findings in human medicine, where only up to 35% of patients with elevated pancreatic enzymes have findings consistent with acute pancreatitis. The presence of DGGR hyperlipasemia, both at admission and developing during hospitalization, was significantly associated with a negative outcome, including longer duration of hospitalization and higher mortality rates. The likelihood of mortality in the hyperlipasemic group at admission was higher compared to the non-hyperlipasemic group. Similarly, for dogs that developed a significant increase in lipase activity during hospitalization, the duration of stay was longer and mortality was significantly higher compared to those who did not. This strong association leads researchers to hypothesize that hyperlipasemia may function as a marker for multiple organ dysfunction or ischemia, rather than solely indicating clinically relevant acute pancreatitis. The study of critically ill dogs identified several independent factors that predicted hyperlipasemia at the time of admission. These predictors included increased age, a history of vomiting, and exhibiting abdominal pain upon presentation. From a laboratory standpoint, predictors also included increased plasma bilirubin and creatinine concentrations, as well as decreased hematocrit. The involvement of elevated bilirubin and creatinine concentrations, along with a decreased hematocrit, a proxy for anemia or fluid status, supports the idea that hyperlipasemia may be part of a multisystem organ failure syndrome. Furthermore, the research pinpointed specific non-pancreatic primary conditions frequently associated with high lipase levels. Among these, renal disease was a prominent finding. Other non-pancreatic conditions associated with hyperlipasemia at admission included endocrinopathies, immune-mediated disorders, and upper airway obstruction. Let us specifically examine the compelling link between hyperlipasemia and kidney disease. The kidneys play a critical role in the metabolism of pancreatic lipase, primarily through glomerular filtration and subsequent tubular reabsorption and enzyme inactivation. Given this function, it is biologically plausible that impaired kidney function, such as that seen in acute kidney injury, could lead to elevated lipase activity simply due to decreased clearance. A dedicated study focusing on dogs with acute kidney injury investigated the prevalence and clinical relevance of hyperlipasemia in this population, both in those treated conservatively and those undergoing hemodialysis. In dogs with acute kidney injury, the frequency of DGGR lipase activity greater than 3 times the upper reference limit was 28.8% at admission. This high prevalence increased substantially during hospitalization, reaching 55.4% of dogs having hyperlipasemia on at least one measurement after admission. Remarkably, almost one-third of dogs, 32.7%, developed marked hyperlipasemia, exceeding 10 times the upper reference limit during their hospital stay. Despite the high prevalence of elevated lipase, only a minority of dogs with acute kidney injury were diagnosed with concurrent acute pancreatitis, 8.8% at admission and 14.9% during hospitalization. This observation aligns with the difficulty in diagnosing acute pancreatitis in the setting of acute kidney injury, where clinical signs overlap and ultrasonographic sensitivity is limited. The severity of the acute kidney injury, assessed using International Renal Interest Society grades, was directly associated with the DGGR lipase activity. Dogs categorized in the more severe grades, International Renal Interest Society grades 4 to 5, had higher DGGR lipase activity both at admission and during hospitalization compared to those in milder grades, grades 1 to 3. However, the correlation between DGGR lipase activity and plasma creatinine concentration was poor. This finding suggests that while kidney injury severity increases the likelihood of hyperlipasemia, the enzyme elevation cannot be accounted for by decreased glomerular filtration rate alone. One of the study hypotheses explored the relationship between hyperlipasemia and treatment with hemodialysis, as marked increases were anecdotally observed in these patients. While dogs receiving hemodialysis exhibited significantly higher DGGR lipase activity during hospitalization compared to those treated conservatively, this difference disappeared when accounting for the severity of the acute kidney injury, International Renal Interest Society grades. This indicates that the severity of the acute kidney injury itself, rather than the hemodialysis treatment, appears to be the primary factor associated with high DGGR lipase activity. Nevertheless, the study notes that patients undergoing hemodialysis frequently experienced a marked increase in DGGR lipase activity, with 20 of 21 dogs in one study's significant increase group having undergone hemodialysis. The significant in-hospital increase in DGGR lipase activity observed in dogs undergoing hemodialysis is hypothesized to reflect subclinical pancreatic damage rather than lipoprotein lipase induction, which is sometimes seen with heparin use in humans, but was unlikely to be a clinically relevant factor in the canine study where citrate was commonly used. Furthermore, hyperlipasemia in dogs with acute kidney injury was strongly associated with a negative outcome. High DGGR lipase activity, particularly during hospitalization, was significantly associated with non-survival at 30 days. Dogs with extreme hyperlipasemia, defined as greater than 30 times the upper reference limit, had 10 times higher odds of death within 30 days compared to dogs with lower lipase grades. This extreme hyperlipasemia was shown to be an independent predictor of survival, even when evaluating only dogs with severe acute kidney injury. Beyond renal failure, other systemic conditions contribute substantially to hyperlipasemia. Endocrinopathies are frequently implicated. Diabetes mellitus and acute pancreatitis often occur together, with studies noting that dogs with diabetic ketoacidosis commonly have very high pancreatic lipase immunoreactivity concentrations. Hyperadrenocorticism and hypothyroidism have also been linked to acute pancreatitis, possibly due to factors like hyperlipidemia or increased pro-inflammatory molecules. However, similar to renal disease, nonspecific increases in pancreatic enzymes without clear evidence of acute pancreatitis also occur in the context of diabetic ketoacidosis. Immune-mediated disorders, particularly those requiring glucocorticoid administration, are another associated category. While glucocorticoid administration was a predictor of hyperlipasemia at admission in critically ill dogs, this may reflect the underlying immune-mediated disease rather than a direct drug effect. Studies in healthy dogs have suggested that steroid administration alone may not cause pancreatic lipase concentrations to exceed reference intervals. Another noteworthy, though less understood, association found in critically ill dogs was upper airway obstruction. While hyperlipasemia has not been extensively described in this context, the abnormality could be related to the high prevalence of gastrointestinal tract issues identified in brachycephalic dogs with upper respiratory syndrome, potentially pointing towards subclinical acute pancreatitis. In a chilling reminder of non-pancreatic causes, hyperlipasemia can be a key finding in cases of zinc toxicosis, typically resulting from the ingestion of foreign objects like American pennies minted after 1982. Zinc toxicosis often presents with concurrent hemolytic anemia and pancreatic disease. Clinical signs such as vomiting, diarrhea, and lethargy are nonspecific, which can delay diagnosis, particularly if the ingestion was unwitnessed. Zinc toxicosis leads to rapid development of toxic blood zinc concentrations after duodenal absorption, causing hemolytic anemia. In 2 reported cases, both dogs presented with hyperamylasemia and hyperlipasemia. One patient showed evidence of acinar cell degeneration and necrosis in the pancreas on postmortem examination, which would explain the elevated enzyme levels. The crucial takeaway in these cases is the rapidity with which pancreatic enzyme activity declines following the identification and removal of the zinc source, confirming that the toxic exposure was the root cause of the hyperlipasemia and pancreatic injury. Therefore, zinc toxicosis must be considered in any dog presenting with hemolytic anemia and concurrent hyperlipasemia. Perhaps one of the most unexpected, and certainly the most dramatic non-pancreatic conditions linked to hyperlipasemia is neoplasia. A classic study described 6 dogs with malignant pancreatic or hepatic tumors that exhibited marked unexplained hyperlipasemia, ranging from 11 to 93 times the upper reference limit for their laboratory, despite having only minimally increased serum amylase activity. The tumors included pancreatic adenocarcinoma, endocrine carcinoma, and hepatic carcinoma. The severity of the hyperlipasemia in these dogs was far beyond what is typically reported for acute pancreatitis or renal failure alone. This profound, unexplained elevation led to the hypothesis of aberrant lipase production by the neoplastic tissue. Using specific histochemical and immunohistochemical staining techniques, researchers found evidence suggesting tumor pancreatic lipase production in 5 of the 6 dogs studied. The positive staining patterns for zymogen granules and pancreatic lipase in the neoplastic cells mirrored those seen in normal pancreatic tissue, supporting the idea that the tumor itself was the source of the excess enzyme activity circulating in the blood. This evidence suggests that marked, unexplained hyperlipasemia can serve as a biochemical indicator for neoplasia, particularly involving the pancreas and liver, although further investigation into the mechanism of elevation, such as the potential formation of macrolipase, is warranted. This phenomenon was tragically illustrated in a case report describing an 11-year-old Siberian husky with a pancreatic acinar cell carcinoma. The dog presented in acute hypovolemic shock due to nontraumatic hemoperitoneum, where the tumor had bled actively into the abdomen. The serum biochemistry confirmed hyperlipasemia, in addition to hyperamylasemia. Following successful surgical removal of the tumor, the elevated lipase and amylase levels decreased to normal within 10 days, strongly indicating that the tumor was the source of the excessive enzyme activity. This case emphasizes that while rare, pancreatic or hepatic tumors can be potent, non-pancreatic sources of hyperlipasemia. Finally, if hyperlipasemia is frequently caused by non-pancreatic systemic diseases, what happens to lipase levels after a dog recovers from an episode of acute pancreatitis? A combined retrospective and prospective follow-up study addressed this question, monitoring dogs for up to 24 weeks after hospitalization for suspected acute pancreatitis. The study tracked both DGGR lipase activity and pancreatic lipase immunoreactivity, finding that both assays correlated very strongly at all follow-up checks, reinforcing that both tests perform similarly when monitoring disease progression. The key finding, however, was the high proportion of dogs whose lipase levels remained elevated long after discharge. 2 weeks after discharge, 22.6% of dogs still had both lipase assays registering above the respective reference intervals. This persistence was even more noticeable 6 weeks after discharge, where 37.5% of the monitored subset still had elevated results. Crucially, the vast majority of dogs with persistently elevated lipase activity had minimal or no clinical signs. At the 2-week check, 79.2% of dogs with persistent hyperlipasemia had a clinical disease activity score of 3 or less, indicating no or minimal clinical signs. This suggests that an elevated lipase measurement weeks or months after an acute episode may often be clinically irrelevant. Dogs with persistently elevated lipase at 2 weeks and 6 weeks post-discharge were significantly older compared to those whose lipase activities returned to normal. Researchers speculate that this age-related persistence may indicate that older dogs take longer to normalize pancreatic lipase after an acute episode, or perhaps are generally more likely to have underlying chronic, subclinical pancreatitis. The researchers concluded that since the vast majority of dogs with hyperlipasemia post-discharge have minimal or no clinical signs, the utility of routinely measuring lipase in clinically normal dogs recovering from acute pancreatitis remains questionable. In summation, the journey through these studies profoundly alters our perception of hyperlipasemia in canine patients. We have learned that DGGR hyperlipasemia is common in critically ill dogs and is associated with increased mortality and longer hospitalization. We know that while severe acute pancreatitis is a concern, enzyme elevation is often driven by non-pancreatic conditions, particularly severe acute kidney injury, where the severity of the renal failure is a stronger predictor than the use of hemodialysis itself. Furthermore, we recognize that extreme hyperlipasemia can signal malignant tumors producing the enzyme themselves, and that certain toxicities, like zinc ingestion, cause acute hyperlipasemia that resolves upon removal of the source. Finally, even after successful resolution of clinical acute pancreatitis, elevated lipase levels may linger for weeks in older dogs, often without corresponding clinical disease. The overriding clinical implication here is clear. Lipase activity is a marker of severe systemic stress, organ dysfunction, or ischemia, and should not be used in isolation to diagnose clinically relevant acute pancreatitis, especially in the complicated setting of critical illness. Thank you for listening. The titles for the reference papers are in the video description. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.